Hey everyone, Dr. Vu Kong here. I'm a general dentist right here in beautiful Elgin, Illinois. And today I'm going to be sharing with you some of my deepest insights I can possibly give you as a general dentist. I'll be sharing with you the top 5 questions you should ask your dental implant provider before committing to surgery. This will help you understand the doctor's credibility in a short amount of time. So let's begin. Alright guys, you're back, so let's dive in. Question number 1. What is the dentist's formal education on dental implants? Who are they trained by? How long was their training for? And what type of training did they receive? These are all very important questions you want to ask. For example, I've gone through multiple CE courses on how to place implants, and that were proctored by some of the top dental implantologists in the nation. That means I've devoted hundreds of hours taking notes, learning about every possible complications that can occur, and I've had to pass all these rigorous exams to get my certification. So as a person looking for a dental implant, you want to make sure you ask these questions and find out a little bit more about the dentist's experience. 2. Does a dental office have a 3D CT scanner? So this is a question that most patients don't understand, the difference between a 2D X-ray that's taken at most dental offices and a 3D CT scanner. So a traditional 2D X-ray will show you the bone and the surrounding teeth. So it'll give you a good idea before placing the implants, but it still leaves a small margin of error. And it's up to the dentist's interpretation to make sure that the implant is placed safely. Now with a 3D CT scan, it can dramatically reduce the error involved in placing an implant. It shows us a complete 3D map of the jawbone and the teeth and all the structures involved. So that way we can plan every step involved in the dental implant process. We can also make a surgical guided stent that will allow us to place the implant at the correct angle, at the precise angle, and then the correct depth. So in short, a 3D scan will reduce the risk involved in the dental implant procedure. And if you're looking to get an implant, try to go with a dentist that has this 3D CT scan. And in our office, we use one every day, and I would not feel comfortable placing an implant without one. Question number 3. Will the dental implant and crown be placed at the same office? So many dental offices will separate the two process. One office will place the implant and the other office will place the crown. Now there's nothing wrong with that as long as the two offices work closely together. The reason why I bring this up is, I've seen some weird cases in the past where one office will place a crown and another office will place the implant, and the two offices fail to work closely together and you get this weird looking crown that the patient wasn't happy with. So I would recommend trying to work with a dental implant provider that works closely with the person who's placing the crown. This way, this will, if the process is done under one roof, this will decrease the margin of error and increase the likelihood that you'll have a perfectly looking crown. Question number 4, how will the dentist account for your medical conditions that you have? For example, patients who have diabetes have a much harder time healing during the whole implant process. So we want to make sure that we account for all those extra steps that are required to have a successful ending. Patients who are taking medications for osteoporosis. This may also affect the healing time and the healing process. And so here at our office, we have an oral surgeon that's here, that's trained and ready to handle all those complications that can occur. Question number 5, how accessible will your dental implant surgeon be after the surgery? This is an absolute must. The fact of the matter is that there's a small chance that something may go wrong after the surgery. And your surgeon did everything right, and a week later your stitches fall out, and you're wondering if the implant's going to come out or if you're going to develop an infection. So you want to be able to make sure that you're able to get a hold of your implant surgeon via text, email, phone, whatever it is. And you want to make sure that he prioritizes you and make sure he's able to answer any questions that you have. I also want to add a side note here. This is one of the reasons why I get concerned when I hear about people going out of the country to get their implant placed, going to Mexico or India just to save some money. If something goes wrong, who's going to fix it? Are you going to fly back there to get this fixed? So you want to make sure that you're able to get a hold of the surgeon after the surgery. So anyway, that concludes the context here. These are the top 5 questions you should ask your dental implant provider before placing an implant. I hope you found this of value, and give us a thumbs up to this video if you liked it. Until next time, Dr. Vu Kong from High Point Family Dentistry here in Elgin, Illinois.